June marks Men's Mental Health Month. The purpose of this month is to heighten awareness of preventable health problems and encourage early detection and treatment of disease among men and boys. A report by the South African Society of Psychiatrists has revealed that South Africa is ranked 10th on the list of countries with the most suicides. Data also shows that men are more likely to commit suicide using aggressive methods compared to women in South Africa. For more on this, we are joined by a member of the South African Society of Psychiatrists, Dr. Ian Westmore. Dr. Westmore, thanks very, very much for joining us. Good to have you on the program.
Thank you. Good to be with you this morning.
And I must say, to actually have a conversation about the mental health of men and boys is a very, very important one. It seems that we never really speak too much about that, do we?
Yes, it's a big problem in general with men's health, but especially men's mental health. And we know that women are far more likely to talk about their health, to go and see a doctor, and that men are often very slow in doing that. And the problem with mental health is, and specifically things like depression, is that people in general don't seek help quickly enough, but it's a big problem with men. And we think that this is the reason why the suicide rate in men is especially high, and it's much higher than the global average as well.
Yeah. So let's get to the bottom of that. I mean, let's sort of start by talking about the state of the mental health of men in South Africa. When you say it's worse than the global average, what are we looking at?
Well, the suicide rate is higher than the global average, and we think that that's because depression is not detected early enough. Because in most cases of suicide, there is an underlying depression. It's often associated with anxiety conditions as well. And the problem is that men are not getting the help that they should be getting because they have the stereotypical role. They think that they must be brave and fearless and always in control and strong. And the moment they start saying that they're not feeling well, especially not emotionally well, they think that they're being seen as vulnerable. And that translates then to this huge problem that we have, that depression is not being treated. We know that globally, about half of people with depression never get treated for their depression. Yeah. So the ones I'm seeing are the ones that are being treated and they have a better prognosis. It's the ones that are not being treated. And for men, it's because they don't talk about their emotions.
Yeah, and that's the reality, is that, I mean, there's so many things you've brought up, but you know, being a man and not, you know, admitting that there's a problem and I'm fine, I can get through this, it's not a big deal. You don't sit like women necessarily, and again, I'm being so stereotypical, but I know us women talk a little bit too much, perhaps. You know, we sit and we'll chat to our friends, we'll chat to people about how we're feeling, but men tend to stay away from that. It's like, no, I get together with the guys and we don't do those kind of things. We'll chat about women, or we'll drink, or we'll have fun, but we don't necessarily talk about how we're feeling inside. I mean, I know I'm being stereotypical, but is that what it looks like? Is that perhaps maybe one of the biggest problems?
Absolutely. And I want to say that this is something that we see across all cultural groups, that there's this expectation that men must not talk about their emotions. Men will typically often display behavior that shows that they're battling. So they'll become irritable and aggressive or withdrawn. And a big problem is, you mentioned alcohol. Now, alcohol is often the way that men start coping with their problems, because it makes them feel better and they drown out their sorrows, as it were. But actually, alcohol is one of the major reasons why men are so successful in successful suicide, because alcohol gives you that Dutch courage and you just go over the edge and it makes you much more impulsive. So for men, they self-medicate with alcohol because they don't have the emotional vocabulary to discuss their feelings with their friends.
And as you say as well, it's those that go undetected. You know, it's well and good. I mean, I know. I mean, I've spoken to a lot of friends, and trying to find an appointment with a psychiatrist like yourself or a psychologist or anybody is probably one of the most difficult things to do for availability, and it's an expensive exercise. So a lot of these cases go undetected and people can't actually get the professional help. So what do we do in a situation like that?
I think two things are important. The first stop should be your GP, because your GP is trained to detect depression and should be able to treat uncomplicated depression. We should be seeing the more complicated cases. But there are instances such as the South African Depression and Anxiety Group that has a free hotline and helpline, as it were, where there's 24-hour help. And that can be a first stop for people that literally feel at their wits' end and are on the brink of a suicide attempt. And they can contact that. I don't know if I can give you the number.
Please, that's what I want to get from you, is just some numbers and advice.
Yeah, it's 0800 121 314, or they can send an SMS to 32312. And there is a trained counsellor available that knows how to pick up these things and will be able to point the person in the right direction.
All right, just as I wrap this up, because we need to get to a judgment, we have a small block on the corner of our screen there where the judgment for the, now suspended, public protector, Busisiwe Mkhwebane, it's taking place. So we'll take that live in a sec. But I think what's very, very important, Doctor, as I let you go, what do we look out for? I mean, what are those signs and symptoms? If people can get involved straight away and make sure that they get help before we get something like a suicide, because we don't want to ever see those things happen.
I think we need to remember that men typically don't talk about suicide, so they're not going to tell you. What you need to look out for is behavioral changes, such as anxiety, irritability, but the two major symptoms of depression are a depressed mood, which we all experience from time to time, but if it is present for at least 2 weeks on end for most of the day. And the second most important symptom is if you can't enjoy things that you used to enjoy most of the time for at least 2 weeks. And then if it's accompanied with changes in sleep, changes in appetite, and in libido, sexual drive, that's an indication that this is not just a normal mood change, but that it's actually a clinical depression.
Let's leave it there for this morning. We thank you so very, very much for joining us. A member of the South African Society of Psychiatrists, Dr. Ian Westmore, talking to us about alarming statistics when it comes to the men in South Africa, that suicide is exceptionally high, as well as depression, things that are just not being addressed adequately, and that's for men and for boys.